as new nurses especially, I feel that we tend to focus on the monitor a lot and not really looking at the patient. So do you have any tips and tricks for that? And just focusing on actually looking at our patient and maybe not just what's on the computer and the monitor.
Right. Yeah. So that's something that is kind of ingrained in us when we go through telemetry courses is look at your patient, not the monitor. It's so easy to look at the monitor and quickly mistaken something for something else, or you're getting, a lot of the times, honestly, it's false alarms. A lot of times I get an alarm saying your patient's like in VTAC, your patient is in AFib, but it's just artifact.
Yeah.
And then it's so tricky because the monitor so many of the times is wrong. So you go to
Hmm.
your patient, you see what's going on. If it's something that's alarming to your phone saying this is VTAC going on and it looks kind of like it, you're going to go see your patient. Even
Hmm.
if it doesn't look kind of like it, you never know what's going on and you want to go assess your patient, see what they're doing. Maybe they're up ambulating for the first time without you and
Hmm.
like their heart rate's skyrocketing. You always want to go and assess the patient first, and then you can further go and look into the monitor afterwards and see what was going on. But it's definitely tricky when you're first starting off because a lot of the stuff on the monitor will alarm for false alarms,
Hmm.
and you'll find yourself running to the patient a lot to double check if they're okay.
Hmm.
And the more you get into cardiac nursing, the more you can actually pick up on artifact, is what we call it, on a telemetry machine. So you can pick up, I know when my patient's getting up out of bed, I know when they're up in the bathroom brushing their teeth. I can see the little artifacts on the screen. And so
Hmm.
I know that, but it took me 3.5 years to kind of pick up on that, right? And
Right.
so when you're first starting off, especially, you're going to want to go and see your patients if anything is alarming, obviously, because if you don't, there could be issues that happen afterwards. But you do pick up on um, what's artifact, what isn't, and you know when to run and when to just calm
Hmm.
down a little bit.
Exactly. And like Barbara, I have also been a nurse for about 3 years now. And it's scary when these things happen, when the alarms go off, and clinical presentation is so important. Let's say it wasn't just artifact on the monitor. You really want to get in there and look at your patient. And their signs and symptoms can really tell you a lot about what's going on.